Take a look at a banana, a cucumber, or even a tree branch. In nature, how many things are perfectly, mathematically straight? Almost nothing. Yet, when it comes to our own bodies, we tend to hold ourselves to a standard of perfection that simply doesn't exist. If you've ever looked down and noticed a slight veer to the left, a tilt to the right, or a bit of an upward arch, you've probably felt that split second of panic. You wonder if you're broken, if it's a medical emergency, or if it's going to affect your sex life. Today on Men Uncovered, we're stripping away the locker room myths. We are going to look at the anatomy, the statistics, and the medical reality of penile curvature. By the end of this video, you'll know exactly what is normal, what requires a doctor's visit, and why a curve might actually be more common than you think. Section 1. The anatomy of symmetry and lack thereof. To understand why a curve happens, we have to look under the hood. The penis isn't just one solid muscle. It's actually made up of 3 chambers. The 2 main ones responsible for erections are called the corpora cavernosa. Think of these as 2 inflatable cylinders running side by side. For a penis to be perfectly straight, these 2 cylinders have to be identical in every way. The same length, the same thickness, and the same level of elasticity. But here's the reality. The human body is rarely perfectly symmetrical. One of your feet is likely slightly larger than the other. One ear might be set a few millimeters higher. Your testicles naturally sit at different heights. The same applies to internal tissue. If the tissue on the left side is even slightly more elastic or a fraction of a millimeter longer than the right, the penis will naturally bow toward the shorter or tighter side during an erection. This isn't a defect. It's just the way biological tissue grows. Section 2. What the statistics say. If you feel like you're the only one with a curve, the data says otherwise. Urologists and researchers have found that a perfectly straight erection is actually the minority. Studies suggest that anywhere from 60% to 80% of men have some degree of curvature. Statistically, a curve to the left is the most common variation, followed by an upward curve, and then a curve to the right. A downward curve is the least common, but still exists within the realm of normal variation. Most of these curves are congenital, meaning you were born with them or they became apparent during puberty. If you've had the same slight tilt since you were a teenager and it has never caused you pain or difficulty, medical professionals consider that a standard variation of human anatomy. It is your normal. Section 3. The 30-degree benchmark. So, when does a curve stop being a variation and start being a condition? Doctors generally use the 30-degree rule as a benchmark. If you imagine a straight line as 0 degrees, a 30-degree bend is significant enough to be noticeable, but usually doesn't interfere with function. Most urologists agree that if the curve is less than 30 degrees and isn't causing physical pain to you or a partner, there is no medical reason to intervene. In fact, many men with a 15 or 20-degree curve go through their entire lives without it ever being an issue. The problem arises when the curve exceeds that 30 to 45-degree mark, as this can make the mechanics of intercourse difficult or lead to increased risk of injury during activity. But even then, the angle is only part of the story. The most important factor is whether the curve is stable or changing. Section 4. Congenital versus acquired curves. It is vital to distinguish between the curve you've always had and a curve that suddenly appears later in life. Congenital curvature is what we've been discussing. It's built into your DNA. It usually stays the same throughout your adult life. However, an acquired curve is different. This is a bend that develops in adulthood. If you were straight at age 25 but notice a significant bend at age 40, that is a signal from your body. This often points to the development of internal scar tissue. While a congenital curve is just a quirk of your growth, an acquired curve usually indicates an underlying process that might need medical attention. Understanding which category you fall into is the first step in deciding whether you need to book an appointment with a specialist. Section 5. Understanding Peyronie's disease. The most common cause of a new or sudden curve in adult men is something called Peyronie's disease. It sounds intimidating, but it's essentially the formation of a flat piece of scar tissue, called a plaque, under the skin of the penis. Because scar tissue isn't elastic like healthy tissue, it doesn't stretch when you get an erection. This creates a tethering effect that pulls the penis into a sharp bend or creates an hourglass narrowing. What causes this? Usually, it's microtrauma. This could be a minor injury during sports, or more commonly, a slight bend or buckling during vigorous sex that you might not even have noticed at the time. As the body tries to heal that tiny tear, it occasionally overreacts and creates a buildup of collagen. Peyronie often comes with a painful phase that can last several months before the curve stabilizes. If you feel a hard lump or experience pain with a new bend, this is specifically what a urologist will look for. Section 6. Impact on performance in partners. Let's address the elephant in the room. How does this affect your sex life? For the vast majority of men, a curve has zero negative impact on their ability to perform or please a partner. In fact, many partners report that a slight upward or side curve can actually be a benefit, as it may stimulate certain areas more effectively than a straight path. The biggest obstacle isn't the physical curve, it's the psychological one. Performance anxiety is a very real side effect of being self-conscious about your shape. If you are worried about how you look, you aren't present in the moment, which can lead to secondary issues like erectile dysfunction. From a physical safety standpoint, the only real concern with a significant curve is penile fracture, an injury that occurs when a curved penis is accidentally bent too far in the opposite direction during thrusting. Being aware of your anatomy just means you might need to be more mindful of certain angles or positions. Section 7. Modern treatment options. If you do have a curve that is causing pain or making intimacy impossible, the good news is that we aren't living in the dark ages. Medicine has come a long way. For Peyronie's disease, there are FDA-approved injections that help break down the collagen in the scar tissue. There are also traction devices, specialized medical tools that use gentle, consistent tension to straighten the tissue over time. In more severe cases, surgery is an option, though it's usually considered a last resort. Surgeons can either shorten the long side to match the short side or use a graft to lengthen the curved side. The takeaway here is that you don't have to just live with it if it's causing you genuine distress or physical dysfunction. A urologist is a mechanic for this specific part of your body. They've seen it all, and they have the tools to help. Conclusion. At the end of the day, your worth as a man has absolutely nothing to do with the degree of a curve. Most of what we see in media or adult content is a curated, idealized version of reality that doesn't reflect the diversity of human bodies. If you're healthy, pain-free, and functioning well, then your curve is just a part of your unique signature. However, if things are changing, hurting, or causing you deep anxiety, don't suffer in silence. See a professional, get the facts, and get back to living your life with confidence. Thanks for watching Men Uncovered. If this helped clear things up for you, make sure to like the video and subscribe so you don't miss our next deep dive into men's health.